So that's what we have today. But let me first welcome all of you and introduce, before I ask my co-chair, Professor Mary Matthew, to, on behalf of the department and so forth, to welcome you. Or maybe I should ask, Mary, do you want to welcome, and Derek, and then I'll introduce the distinguished international panel that we have today.
All right. So thank you, Professor Russell. I'm Mary Matthew. I'm a professor of pathology here in KMC Manipal in India. I'm also the head of the Indian program of the UNESCO Chair in Bioethics. And today I'll be the moderator for our 29th webinar. And we have a very distinguished panel here who will be discussing on the political influence in public health science. I'm a professor of pathology here in KMC Manipal. All right. Okay. I think there's a Derek. Is there a is there an echo that's coming?
No.
No. Okay. It's because all right. Okay, and today's webinar is on political influence in public health science during COVID-19 pandemic, the duality of politics and health science. Now, this is a very hot topic. Last week, we discussed on biopower, but we were not able to discuss it completely. Today, we'll take up a few issues. I know that we are not able to, continue our discussions and we are not able to cover a lot of topics, but we will do our best according to how much the time permits. So I will request all the panelists to please be as, to the point as possible and keep it brief so that we can discuss many other issues. And as always, please, to all our participants, feel free to post your comments and your questions in the chat box. With that, I will hand it over to Professor Derek, who will give you the house rules. Professor Derek?
Yes. Thank you, Professor Mary, and welcome to everyone. Good to see you back. And a very happy Diwali to everyone who's celebrating here in India and all around the world. And thank you for being here, despite all the commitments. To preserve the fidelity of the telecast and to avoid interference, may I request each one to just check that your microphones are on mute whenever the discussion is on. And other than our participants, can I also request everyone to keep their videos off during the initial part of the webinar. If you have a question or a comment, we'll request you to come with your video on and give you a chance to speak towards the end, because that improves the quality for each and every one of us. Also, a reminder that this is being live streamed on YouTube. I'll be putting the link in the chat box any minute now. So you can also share that with your friends, colleagues, and students. And the recording will be available on that link as well. So welcome once again. Back to you, Dr. Russell. Thank you.
Thank you, Derek, and thank you, Mary. And again, once again, welcome. I'm delighted that we have a spread participants from all regions, South America, North America, Middle East, Africa. I can see from Europe, a significant number from Europe and Australia. We have one more, one panelist is from China, supposed to be joining us any moment. But anyhow, it's now, I'm going to introduce to you the very distinguished panel we have here. Let me start with Professor Vivian Hopwood, who is the professor of health law at Cardiff University, and she's also the chairman of one of the national health NHS boards, and so directly dealing with the COVID. And I welcome Vivian. Then we have Professor Joseph Taunton, who's a professor at the University of Florida, who's also the head of a bioethics unit the UNESCO program and part of the education department. Welcome, Joe. And I'm delighted to introduce Professor Ravi Venkadekar, who was here last time but couldn't speak. But Ravi Professor Ravi is the treasurer of the World Medical Association, and he's also been the past president of the Indian Medical Association, which is the largest medical education in the world. I'm sorry, Indian Medical Association, which is the largest in the world, and part of the WMA, and also the president of the SAC, or the South Asian Regional Cooperation Association. And then I have Professor Rajiv Tandon, who is the chair of psychiatry at the University of Western Michigan in Kalamazoo in the state of Michigan, United States. He's joining us and he's going to be with us. Welcome, Rajiv, and thank both of you for early morning getting up to be with us. And now I want to introduce, where is our Miriam? Can't find Miriam. Is she? Ah, yes. Professor Miriam is she is the director of nursing and a professor there from the Nairobi University in Kenya. Welcome, Miriam, to this panel. And I'm delighted to introduce to you Dr. Alvin Chan, who is joined us from Hong Kong. He's from the Hong Kong Medical Association and a pediatrician, very actively involved in the medical and political aspects. And so he will be a great panel member. Then I have Deborah Cavalcanti. Professor Deborah is from the Medical Council of Brazil, again, actively involved there, and we have she'll be will be able to give us a good understanding of this area, this aspect take place in Brazil. And then I have Professor Walter Joko, who's from the director of the KV Institute of Clinical Research at the University of Nairobi. Okay, so that takes us through our team here. And Leon, I'm so sorry, Professor Leon Cohen-Bello from Buenos Aires, from Argentine, and who is the president of the Argentine chapter of the Israel Medical Association in Buenos Aires. So he's also there. So we have covered South America, North America, then we have Africa, India, and Hong Kong, China, and so forth. So we have UK. And I just want to, we will in the end, I am from Australia, I'm talking to you from Australia, but I have with us, and I might call Dr. I asked Dr. Matheson. I don't know if Dr. Matheson is there. Oh, yes. Yeah, Imon Matheson from Australia. We might get you, who's actively involved in Australia in looking, has taken an active role in, looking at the lockdown and looking at government action here. So we might get him to also give us some comments from the Australian perspective. Okay, so with this, I might just have a couple of words to say before we go on. As I said earlier, this political interference in public health science during COVID-19 is it's confined not only to the duality of politics and health science, but to politics as an instrument of power and science as a liberator of mankind from the darkness of ignorance. Now, the topic of political determinants of health has been a subject matter of discussion for more than a decade. And from that, it has become almost clarified why health is political. And this political aspect sees how health is unevenly distributed. And we see that many health determinants are dependent on political action. And we see health is a critical determinant of health, of human rights and citizenship. Even recently, the WHO Director General himself declared on September 23rd, 2019, in discussing the universal health coverage, saying it's a political choice, right? So we see that the COVID-19 pandemic has indeed made it clear that scientific evidence and messages to the public by our political leaders are not always on the same page, leading to often to confusion, even eroding public trust. Political interference in public health science has sadly been a spectacle that the world has been privy to in the wake of this current pandemic, and that is referred to in the BMJ editorial. The world is learning as we go through the various phases of this pandemic. Governments are faced to deal with consequences of health as well as economic impact. As much as governments are trying to balance on one side the public health and the other side the economy, we have seen instances where political leaders of nations have been undermining science and evidence for reasons beyond the comprehension of the common man or common person. The early proclamations by leaders of democratic nations, as we have US, India, Brazil, on hydroxychloroquine as a treatment for COVID, led to the panic buying and so forth. And this has shown, although this has shown to have no benefit following the recovery trial, and was and widely hailed, hailed clinical trial. Likewise, more recently, we've seen monoclonal antibody therapy for COVID-19 has come into the media limelight in the wake of it being used to treat the US president, despite the lack of robust evidence and the current ongoing clinical trials to find the answer. Now we see the quest for a vaccine against COVID-19 has become again a political supremacy race, with certain nations trying to outreach each other at the expense of undercutting safety and efficacy rigor. In unprecedented times like this, science and politics should build public trust through transparency, synchrony in public messages and policy making. It isn't about one versus the other. It is about the time to win the confidence, indeed, of all the citizens. And this webinar is focused on, as you know, we have been doing this to different aspects, and the next few we'll be seeing. The next few have already been planned, where you will see other aspects being taken in. And indeed, I want to open this up, and I want to welcome Professor Mary Matthew, the moderator for the last 28 webinars. So we're going to have a robust deliberation here, and as she said, we try to keep it short so that we can go through all the questions there. I'm delighted to welcome all of you, and over to you, Professor Mary.
Thank you, Professor Russell, and may I also welcome Professor Geeta Lakshmi is also with us. She's also Vice Chancellor here in India in one of the universities.
Dr. Dalvi is also come.
Okay, and Professor Dalvi, welcome. May I request all the panelists to please keep your videos on so that I do not miss you. And Ariel, you can also put your video on. Ariel is our interpreter for Professor Leon, and he'll be translating the questions and responding to the answers. So thank
Mary,
you.
Mary,
Yes.
one moment. I've got Dr. Eamon Matheson. I just introduced him. I just said I didn't know where he was, but he's put on his video. So welcome, Eamon, to this. Yeah, so we look forward to hearing from you from Australia, who's actively involved in this work here. Okay, thank you. And back to you, Mary.
Right. So thank you very much. And I just want to bring to your notice that there was an article that was published in the BMJ recently in October 2020 regarding the role of politics, the influence of politics and its effect on public health and the COVID-19 pandemic. So I'm going straight with a bang to the question that I want to ask first to Professor Ravi from India. He is the treasurer of the World Medical Association. Now, Professor Ravi, how much of the political decisions have contributed to COVID-19 becoming a pandemic?
Thank you, Professor Mary. First of all, on behalf of all the Indians, let me wish every one of you a very, very happy Diwali, our biggest festival in India. Firstly, let me congratulate your entire team of Professor Russell for bringing out this very, very important topic of politicization of this entire crisis. As such, health has been a political issue. And unless and until we get a political support, health of that country, especially the public health, is not improved, which we have experienced for last 70 years since our independence in India. Slowly and steadily, the health has taken a backstage on the agenda of politicians, which has led to the neglect of the public health infrastructure. And this has now things have come to a pass because of this COVID pandemic. If you'll also see, other than the BMJ editorial of 12th or 13th of November, there has been a study published by a Frontier Swiss, which is a Swiss group, which publishes a lot of medical journals. They did a survey in May and June, covering more than 25,000 scientists, and they could collect data which showed that what percentage of scientist advice or scientific advice was taken up by their governments. And the findings are no surprise that New Zealand, South Korea, the Scandinavian countries except Sweden, all have very high percentage of the government listening to the scientific advice. And there you will find that the COVID pandemic is well under control, while the least amount of scientific advice taken up by the governments. And obviously, Russia, USA, Brazil, all they fall in the less than 20%, where you will see that the pandemic is raging. Coming to India, we have observed for last 9 months that politics has overtaken the scientific advice, and that has been manifested in multiple ways. The federal government and the various state governments, especially the state governments not controlled by the ruling party, they were always given a stepmotherly treatment. That is point number one. Point number two, by invoking a 19th Century Epidemic Act and a Disaster Management Act, the federal government took control of all the policies, all the supply of all the essential items, the medicines, the personal protection equipment. For first 6 months, it was totally in the hands of the federal government. Whether to import it, how much is to be manufactured, everything was centralized. And unfortunately, as I said, politics overtook that which state will get what kind of supplies, what kind of essential medicines. Thirdly, whatever advice the government, so-called the task force for COVID were appointed, 99% of them were filled by the government officials only. And where in India, we all know that 70% of the healthcare delivery is done in the private health sector. And such a large, vibrant private health sector experts were not included at all, neither at the provincial governments, neither at the federal governments. All the task force were packed with the government health officials only, obviously, which resulted in very lopsided policy managements, the contradictory orders being issued, science not being followed. It was very, very surprising that the chairperson of the task force for the Prime Minister himself, in May, he declared that by 16th of June, India will having 0 cases of COVID-19. And we saw that in June, July, August, September, the cases rose dramatically and we had our peak. Fortunately, now we are on the decline, but still politics is overtaking the scientific advice. Unfortunately, I would also like to make a small point here about vaccines and availability of drugs. Unscientific drugs were promoted by governments, and very obviously there was, of which we feel very strongly, that there is a pharmaceutical and medical equipment producers nexus with the politicians, which saw certain companies share rise exponentially when it was announced that certain drugs or certain vaccine trials were successful. In fact, there was also another small thing before I conclude, that our Honorable Prime Minister wanted to declare, it seems, that Indian vaccine is ready by our Independence Day, that is 15th August, which I think was very, very sad. Fortunately, good sense prevailed, and then that circular by our health secretary was taken back. So India, in that Swiss survey by the Frontiers, ranges midway between around 40 to 45% of scientific advice is heeded by the government, and that itself shows that is why we had a very big, or rather we are number 2 in overall cases in the world. Thank you, Professor Mary.
Thank you, Professor Ravi. That is the question. How much of politics actually has contributed to making this this pandemic, this COVID-19 a pandemic? And we have seen that in countries where the scientific community was not included in decision making, they are the countries that are doing very bad. So in this BMJ article, the first country mentioned was USA, followed by India, and then Brazil, and then so forth. UK came, United Kingdom came the fifth. So Professor Leon, I'm going to, Professor Leon is from Argentina. How much of political influence or decisions have contributed to this COVID-19 becoming really a pandemic in Argentina? Ariel, you can you translate that for Professor Leon? How much
Yes,
of
can you answer again, please?
Yeah. How much of the political decisions that were made resulted in COVID-19 becoming a pandemic?
¿Cómo las políticas en Argentina impactaron en la pandemia del COVID?
Ha sido una de las pandemias, una de las cuarentenas más largas que ha soportado todo el mundo.
It's been one of the longest quarantines in the world.
Was in Argentina.
Yes.
Yes. Han sido 8 meses de restricción de la economía.
8 months of restrictions.
Okay.
Economía, trabajo, salud, que impactó sobre una situación previa muy grave.
It has had impact on the previous situation.
Okay. Impact on the previous health situation that was already there.
Health and economic situation.
Okay. But what is the decision that was taken by the government that contributed to it becoming a pandemic?
¿Qué decisión del gobierno contribuyó a que esto, digamos, sea una pandemia?
Han sido decisiones erráticas que no fueron cumplidas por todas las provincias.
It has been erratic decisions that hasn't been,
Consistent?
yeah, by all the states.
Okay, around in the whole of Argentina, it was not consistent.
Yeah.
Okay, so how many were there? Was the government taking scientific advice from the health force?
¿Fue aconsejado el gobierno por científicos?
Lamentablemente sí, porque
Unfortunately, yes.
Okay, so is that good or bad?
¿Es bueno o malo?
los hechos mostraron que fue muy malo.
The facts show that at the end it was bad. ¿Pero por qué fue malo?
Okay,
Que aconsejen.
Professor Leon, give us examples.
Darles ejemplos.
Hubo un conjunto de 20 epidemiólogos que asesoraron al presidente.
There was a group of 20 epidemiologists that gave advice to the president.
Pero solamente epidemiólogos, no hubo otras disciplinas como psicólogos, psiquiatras, gente que trabajara con la ética. Entonces, únicamente se trabajó sobre números que no fueron adecuadamente llevados adelante.
There were only epidemiologists, but not psychologists or people who works with mental health. So there was only numbers going through and not another scientific issues, especially mental health and.
Okay, so it was just a group of public health officials who were advising the government, right?
Si fue solo personal de la salud pública asesorando al gobierno.
Sí, no hubo ningún otro sector trabajando en una salida conjunta de la pandemia.
There wasn't any other area working on a global decision about the pandemic.
It was just focused on one particular aspect of the pandemic, right?
Yes. Yes, only numbers, not
numbers.
Another issues like mental health.
Okay, the other health issues.
Exactly.
Okay, why did that happen? Why was it only public health?
¿Por qué fue de esa manera? ¿Vos crees?
Porque hubo un predominio de las luchas políticas sobre la concepción científica de la gravedad de lo que estaba ocurriendo.
Because the politics dominate over the scientific about what was going on. Yeah.
All right. Okay. Thank you very much, Professor Leon. I'll come back to you. Professor Vivian?
Yeah.
You're muted.
Good.
Apologies, sorry about that. Yes, it's a really fascinating topic, this, because clearly there's such a complex relationship between politicians and scientists. And in the UK, I think the problem was that the politicians, of course, hold the power. Ultimately, it's the government that introduces public health measures through legislation to protect the public. Unfortunately, in the UK, our Prime Minister and the government delayed. They listened, and Boris Johnson, the Prime Minister, would appear to make public announcements with the Chief Medical Officer on one side and the Chief Scientific Advisor on the other side of him. But they couldn't make up their mind. They delayed. And I was quite fascinated by the advice that he was taking, because who were these mysterious people, often working in the background to collect and analyze the data, describing the spread of the pandemic and the effectiveness of treatment and so on, to inform the decisions. And when I looked them up, this body called SAGE, the Scientific Advisory Group for Emergencies, which has a number of subgroups, I was surprised to see how many people were on that body, members of it or of one of its subgroups, and it's well over 200 people.
Oh.
Very eminent people, including behavioral scientists, mathematical modelers, a serology group, a clinical information network, environmental working group, a children's task and finish group, and a hospital onset COVID-19 group, as well as an ethnicity subgroup. And despite dire warnings by this large and very eminent group of scientists, they dithered, the politicians dithered, didn't act soon enough to introduce a period of lockdown and an efficient system of tracking and tracing. The other devolved nations, remember we do have devolved jurisdictions in the UK now, Wales, Scotland and Northern Ireland, in the end decided that they weren't being involved enough in discussions. And in the end, they went their own way. And after an initial period of lockdown, different rules have been applying across each of the devolved nations. That is not good. That is likely to cause a spread of the pandemic. There was a considerable debate about whether we should allow university students to come back, because young people are often asymptomatic. And clearly, once they get out into the community, even if they want to prevent the spread, they may not know that they have contracted COVID. And there was not an adequate system of tracking and tracing and testing people at that point. Obviously, it's very, very important that we learn to trust scientists. If you look at all the polls, the most recent poll conducted by Ipsos Mori in 2019 indicated that the public trust scientists the most,
okay.
followed by doctors, and politicians the least.
Okay.
So from the point of view of the general public, people who are frightened, people who want to stop the spread, we feel, the public feels, I should say, that they've been let down by politicians, and the situation in the UK is not good at the moment. So as far as I can see, I think we ought to be listening much more to politicians ought to be listening very much more to the scientists. And I can tell you in Wales that we do. I have regular meetings with the health minister through my work for the National Health Service, and Wales is listening, as is Scotland. And I believe now at last, so is England. But there's so much political infighting going on that there was an announcement even today that the Prime Minister has sacked a group of his advisors, because the feeling is running so strong now among politicians that something really radical needs to be done to improve the situation.
Yeah, thank you, Professor Vivian. What you have described actually is the dream team that any government could have had in advising COVID, on this pandemic. Unfortunately, it was not taken. That is the saddest part that, of the whole thing, that you have systems in place, you have advisors, and they're not listening to what the scientists or the health professionals have to say. Wasn't there transparency in this?
Not sufficient. I mean, one element of good governance is transparency. But in the end, some months ago, the Prime Minister started to blame Public Health England, because when things started going wrong, it was necessary, as many politicians do, to find someone else to blame. So we don't know what was going on behind the scenes. I don't know exactly, but there have been newspaper reports about it. We have been watching with fascination what's been going on in the United States of America. And I noticed yesterday in the Times newspaper that Joe Biden, the president-elect, made a statement to say that dealing with the virus pandemic was one of the most important battles that his administration would face, and that he would be informed by the experts.
Yes. So that's a priority now. Yes.
Yes.
We will go to you.
Yeah.
Go ahead. Sorry.
Sorry, well, just to say that, you know, looking at the lessons that can be learned from the UK is to act as quickly as possible on the basis of scientific advice.
Yes, thank you, Professor. I'll go to USA and Professor Rajiv. I think President Trump keeps firing all his health advisors, and you know, when it came, during this pandemic, what was the role of all the? We've seen it. We know what has happened in USA about the political decisions, the delay in taking decisions, or you know, not consulting scientists or the health force in this pandemic. Give us a perspective, Professor Rajiv, on USA.
So let me actually be quite candid. You know, when I looked at the list of questions that you circulated, I'll get to the US context in a minute. When I looked at the list of questions and how they'd been phrased, and actually as I'm listening to the first 30 minutes of this conversation, and the way you're phrasing questions and the way they're being answered, you know, there's an assumption here that politicians versus physicians. And actually, even in physicians, I mean, there's an interesting question you phrased, and it was answered that way. So it was not health professionals, but only public health officials guiding the government, which is interesting. I mean, public health officials are health professionals. And I think this is, you know, as I share with you the US experience, I think it might be useful for us to really look within and look at what we are doing as health professionals and as health organizations. So let me share with you the US perspective. I'll admit it here, I don't have to. I did not vote for the Trump. And I campaigned against the president actively. Having said that, I think it's important to recognize that both within my country and around the world, there is a lot of misinformation, misunderstanding, confusion. And what you think is happening here is not really all that's happening here. So what is happening here? And let's start with facts. We have done very badly. We have done very badly in this country. We have the highest number of cases, the highest number of fatalities, and we have done badly as a country. We've mismanaged this. We should have and could have done much better. Let's start with that. The second thing is, you know, we have done a few things well. Not a lot of things well, but we've done a few things well. You know, when Pfizer announced the initial success of phase 3 trials in terms of efficacy, in part that owes to a particular plan from the government of saying, you know, we will. Why don't we want at least 100? We want at least 100 million doses available at the time of approval. Obviously, you don't know it's going to be successful or approved. So why should a pharmaceutical company take the risk? So as part of the Warp Speed program, the president has some, you know, should receive some credit for this. Basically, the government put $10 billion, several tens of billions of dollars to different pharmaceutical companies to support this and said, you know, this is our contribution. If it doesn't work out, we're sharing the risk with you. And so I think it's important to recognize we've done a lot of things wrong, but we've done a few things right. And it's important to put all the facts on. So the first thing I would say is we've done badly. And so why have we done badly? And I think a lot of reasons why, in part, it's the structure, the federal structure of our country, which is good and bad for other reasons, but it's a challenge. You know, Professor Vankadekar spoke about the challenges in India with state governments, private versus government, health professionals, etc. So the structure of any country constrains what you can do. So that was a factor, but it shouldn't have caused this. So what happened? There was mixed messaging, confusing messaging, and it caused confusion at decision-making levels. It caused confusion amongst the public, which has a significant role to play in terms of the response. And it caused confusion amongst healthcare professionals. There was a lack of transparency. There was a strong political context, which I don't want to go into. But I think, before we think about what can we do better, it's important to understand what we have not done well and start off with facts, not blame, saying, oh, it's the politicians interfering, things of that sort. So what about the health professionals in the USA? And so I know Dr. Fauci. I have great respect for him. He's an incredible professional. He's not a public health official, although he plays a role in public health. He is an infectious diseases specialist. Dr. Birx has done disaster-related healthcare work and is a public health professional. So it's important to recognize in terms of the US context that both those roles are important. They work very well together. Dr. Fauci and Dr. Birx work very well together. And the challenge was, in terms of our understanding of COVID, it's improved over time. I mean, looking back, hindsight is always 20/20. Dr. Fauci, at the beginning of the outbreak, said, don't wear masks. Now, why was he saying don't wear masks? He was saying don't wear masks because masks was scarce. And so he wanted healthcare professionals to have those masks because they were at risk. And so if those masks were taken over, were consumed by the general public, healthcare professionals would have less access to them. So now the problem really is, if you look at the fact, this is what he said. And so and the only point I want to make here is it's important to look at all facts. Let's not look at a selected selection. You cite some quotes from the WHO. You cite some quotes from Lancet articles, if you will. But there are a whole bunch of Lancet articles. Look at all of them. Look at all the WHO, for example. I'll give you another US context, which is relevant to the rest of the world as well. Mass gatherings. There is a WHO expert panel on mass gatherings. Take a look at its report. And the problem is we politicize everything. We politicize it. The general public politicize it. Politicians, of course, exploit it and things of that sort. That's a different issue. And we don't help as healthcare professionals. Mass gatherings. If it's a Black Lives Movement mass gathering, oh, it's a wonderful thing. And most of them are wearing masks anyway. And it's a good thing. Celebration after President Trump lost, very good thing. But any political gathering that President Trump speaks back, very bad thing. Well, either mass gatherings are okay or not okay. And there's a context to that. Let's be clear. Let's not be selective in terms of our criticism of stuff. But take a look at the WHO panel report on mass gatherings, WHO panel on mass gatherings. Take a look at it, and I think it'll be useful. So the last thing I want to say really is, I think we've done a lot of things wrong. I'm hopeful that in our country, we are learning from it. We have learned from it. President-elect Biden has put together an outstanding team of COVID specialists. Clearly, it's of the highest priority. And it's not only frontline healthcare providers who should be at the table, so should be public health professionals. So should be economists. So should be a whole bunch of people who have a legitimate place at the table. And I think the next question is, if we can start off with that shared sense of understanding, a recognition we've got to look at all facts, not just piecemeal facts, and allow ourselves to be less arrogant, encourage ourselves to be a little more humble, a little more honest about the whole thing. I think, and have a little more empathy and recognition of the roles that others have a place at the table and have an important role to play and a certain expertise. We have a lot to share too, but we're not the only arbiters of what decisions should be made at a political level. I've got some thoughts about how we can do it, but let me leave that for later.
Professor Rajiv, because what you're saying is the same thing that Professor Vivian Hopwood said. The advisors to the government were all these that you were talking about. But ultimately, the decision was not taken to go to, regarding the pandemic. So to clarify, because you started saying that it's not only, correct me if I'm wrong, it is not only, a particular group of people, it it is everyone. Is that what you meant to say?
What my bottom line is really, I think it's important for us to look at all, not a selection of facts. Let's look at all the facts. Let's put them on the table. Let's also not begin by pointing fingers. Let's begin by looking at what is happening, what has happened, and also reflect on what we have done and what we could have done better.
Okay, no, that's okay. That's fine. I mean, the pandemic has taught enough lessons to us, and we will learn from it. Hopefully.
But Mary, I think one last thing. I mean, I don't think I answered the question you asked me, and so let me. I was processing it. Basically, when you say that we gave certain advice to the government and they didn't take it, that's ridiculous. It's like saying my investment banker told me that a particular investment would be good and I didn't take it. Well, that investment banker is one part of my decision making. He or she is not the entirety of my decision making. So if I give, remember, I'm not the decider. As a healthcare professional, and I don't think I should be the decider. I think I have an important voice. I must be at the table. I must be honest. I have a responsibility to the people at large. I have a responsibility to my profession to be honest, to have integrity, and to actually be very clear about what I'm saying, what I know, and what I don't know. Because, and it's important for me when I present stuff to separate what I know from what I believe, because they're both important, but they're separate.
Okay, so all right. So Professor Joe, do you have anything to contribute? Because we're still in USA. You'll have to unmute yourself. Yeah.
Right. So Dr. Tandon and I can talk for hours usually on topics. It's hard to know where to begin. He talked about our responsibilities, and we had failures and responsibilities. We did not have honesty. We had deliberate manipulation of data from the government leaders, exactly. And the public health people were complicit in that in a large degree, or they were fired. But we needed people to get fired. Fauci's people admire him because he's tried to navigate a course with this government, but he has been more contrary to what the president's office has said than other leaders. We had failure in the CDC to follow through on testing. We had failure in action to get the PPE done.
Professor Joe, correct me if I'm wrong. My understanding is there was pressures on the CDC not to release information, and so
that's correct. And the failure is you have to resist that or state publicly where the problems are. There is this navigation and nuance and humility, but some things are clear. The reason why we discovered community transmission in February of this year in Seattle, and why it was discovered in Seattle, was because the Seattle healthcare system went against the CDC and didn't follow protocol because they followed what was necessary. We have a long history of ignoring public health in the US, from smoking, denying that cigarettes cause health, drinking and driving, use of seat belts, HIV, all those things have been slow. This pandemic, the speed sort of outruns us, but there has been specific failures and manipulation of this administration, which made it worse. From denial of the epidemic to failure to respond with the PPE, to politicizing people who gave different points of views to punish them, where to the point that even this weekend, the president stated he was going to allocate the vaccine based on political favor by withholding it from New York. So there's a lot of issues that are specific ethical failures of people, and that's why we have to build up our infrastructure for ethics. There is certainly things we don't know, improvements to be made in transparencies, but we also have to develop our ethical core to survive these things.
I think, let me just say one thing if I could. Joe, I completely agree. I think, this whole thing about, again, part of, you're right. We can have this conversation for years at end, not just days and weeks, you and I. But I would share that you and I have worked very closely together in a healthcare system. We worked with politicians and we worked in systems of care which have significant political impact, influence, if you will. And we struggled with it. And we've done it with in my mind, high integrity. And we've tried our very best. It's always a balancing act. And I agree with you. I think honesty, integrity, our responsibility to our profession is key. But the one thing I would say again, in some of the assertions you're making about I'm going to withhold it from New York, there is a broader context to that. If New York, the governor of New York says, if this is basically approved under this administration, I don't want this vaccine. That's exactly what he said. That's exactly what Governor Cuomo said. Then why would you want to allocate the vaccine there if the governor is saying, I don't accept your vaccine? Where is the mix? I mean, I'm not a defender of this president. Quite honestly, I am, this guy has caused a lot of damage. He's damaged our country. He's damaged the world. He has really inflicted significant harm. And I think what's happened in the US with regard to COVID, and also we could have made so much of a more positive impact on how the world has handled COVID. So no argument there at all. All that I'm suggesting is please, 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 if we allow ourselves to go down this rabbit hole, it was all this terrible Trump guy, I tell you. And once he's gone, everything's going to be fine. We'll be making a big mistake.
All right. So that was one of the probably one of the contributing factors. So we have to look, like Professor Rajiv is saying, look at it, a little more wider. Hopefully, let me just go to Professor Miriam. Professor Miriam, I know all of you are waiting for your turn, but I cannot stop any of our panelists because I want them to say what they have to say. So I'd appreciate if everyone's, a little patient. Professor Miriam, in Kenya.
Okay. Thank you very much, Mary. And I'm Dr. Wagoro, not professor yet. I am sure I'll be professor in the next few years.
I'm giving it to you.
Thank you very much. Now, when we look at the politicians and the scientists, there are two things. The scientists want to save lives, so they will give very strict measures. But even within the scientists, we have the social scientists who will also want to look at it a bit differently from the health scientists, because for the health scientists, they would want everybody to stay at home. They would want social distancing. They would want wearing of masks. But the social scientists will say, wait a minute, staying at home has its own other complications, bringing in a lot of domestic violence, bringing it a lot of depression, bringing in a lot of suicide. So even within the scientists themselves, we need to harmonize the arguments between the health scientists and the social scientists. Now, when we get to the politicians want to feel that they are in control. And so in Africa, we know that there are countries in East Africa which decided that they were not going to have their people wear masks. They were not going to have people being tested. They were not going to follow the issues, the transmission protocols. So in those countries, even the testing is not being done. So it's very difficult to know the prevalence of COVID-19 and even the death rates there, because the politician feels that they want to be in control and this will affect their people.
Yes.
But in Kenya, I want to say that our president initially listened to our scientists and had a lockdown. But then even within the political arena, his people did not listen to what he said, because it was said that there should be no mass gatherings. People should put in masks, but the politicians never bothered. when there are deaths occurring to the relatives of the politicians, we find you get more than 200 people, there is no mask wearing. The politicians themselves, as they address the gatherings, don't put on the masks.
Yes.
So then the public is wondering, why should the politicians don't put on masks, and as we are being told to put on masks, and that has implications on transmission.
Yes.
Then there was a time when the bars or the drinking places were opened, and people were being told, look, you still have to stay at home, you should not gather much. But then people were asking, then between ourselves and our people and what we are doing and the bar, where is the risk? And then you find that the policies which are being put in place, the public are not willing to observe them because the politicians are behaving differently.
Yes.
Then it came to the issue of opening up the schools. There was a time when there was an issue of corruption, and there was a lot of question on our national agency that is charged with the procurement of PPEs. Before then, the numbers had started going down, but then after that, the numbers suddenly raised.
Okay.
No, after this corruption issue, the numbers suddenly went very much down, and now we are seeing like the numbers are coming up.
Yeah.
And then the general public are saying, why are the numbers coming up now when they went down that time? Although when you talk with the colleagues in the areas, in the COVID areas, they really tell us in the hospitals, there's a lot of, there's a resurgence now, and many people are actually dying. In our own colleagues, we've seen so many people dying. But then it is the time the government is saying, we open up schools, the universities must open. So then we ask, when the cases were slightly low, we had a lockdown. Now the cases are going up, why are the schools and universities opening? And so that becomes a debate where the public are feeling that they are not being treated fairly.
Okay.
But so then there must be a balance between the science and the politician. It would be useful also to hear from the consumers of the services. Many times the patients are not heard. It is only the scientist versus the politician. We must strike a balance on what is working and how do we then pass the message of what is working in a manner that we are able to get public confidence. Thank you.
Yes. Thank you, Miriam. Professor Walter?
Yeah, thank you. Thank you very much, Mary. I'll be brief. As Miriam has already indicated, the government of Kenya relied on a lot of advice from the scientists and the medical team, but they also had an economic team. And that, to me, is where the rubber meets the road, because when you have all this good medical advice, but then you're also getting a contrary advice from the economists.
Okay.
Because COVID is not just a health issue, it has a lot of economic impact. Now, maybe speaking on behalf of Africa, the majority of the people who are working in the informal sector. There are people who are self-employed, who live on a day-to-day basis. So if you lock them down, that day they have no money for food and for their household expenditures. And the government does not have the resources to support them.
Yes.
And so when you're faced with the fact that you're locking out 80% of people who are working, and they have no other source of income, you're not able to support them. The politicians see situations where you can have a revolt, you can have something akin to the Arab Spring.
Yes.
And so the politicians have to balance between what they know as medical and scientific facts and what they also know as reality. If you're told lockdown the country for 3 months. You can't, because there'll be a riot, there'll be a revolt in the country. So I think, to me, that has been the dilemma, in addition to what Miriam has talked about, where in a country like Africa, the politicians are the opinion shapers. So in a situation where you're preaching water but taking wine, people don't listen to what you're saying. People observe what you're doing. So if you're telling us to wear a mask, but you yourself are not wearing mask, and you're telling us not to gather, to practice social distancing, but you yourself are not practicing, people then follow what you're doing more than what you're saying. And finally, we are in a situation where we are about to amend our constitution. So this started before the COVID pandemic came in. And so the politicians have an interest in ensuring that the constitution is amended in a way that is favorable to them. Okay. And the only way they can do that, because we are going to have a referendum, is to go out into the country, urging people, convincing people on the draft amendments that have already been put in place. So they see time running out. If you lock people, if you don't have these gatherings, they will not be able to pass their messages. So there is a lot of self-interest amongst the politicians as well. Thank you.
Yeah, thank you, Professor Walters. This has been, we've been seeing it globally. They they preach something, but don't practice it. So the public are also, they're like, why do we have to do it? That kind of thing. So we have seen that even in India, that has happened. So this contradictory kind of, messages and practices. Professor Matheson, are you there? Yes. From Australia?
Yes, I am. Again, I'm not a professor.
No, today I'm going to make everyone professors here on the panel.
Yeah.
Okay. Now, I think in Australia, you had the same problem, right? Because one part of Australia was completely locked down and that people were very unhappy. And then the rest of Australia was open.
Correct. Well, yes and no. We think that there's a group of doctors, there's differing opinions, and I'm going to give a different opinion to what has been expressed here, I think, even against the Americans. But I think the management has been disastrous, and listening, also Vivian, I would disagree with the approach that the UK has had. The problem was that they listened to people at the Imperial College of London, Neil Ferguson, and the computer modeling that they used was absolutely mistaken, and it's been disastrous in their understanding of what has happened around the world. People like John Ioannidis, the people that wrote the Great Barrington Declaration in Harvard and as well as Oxford and coming out of Stanford, they have a very different perspective on this, and they think that what has been devastating public health-wise has been the management of this SARS-CoV-2 outbreak. The lockdown impact is been extraordinary across the world. In Australia, it has been devastating. It has been mentioned a couple of times about the impact on mental health, but it basically has impacted every other medical condition known to man other than COVID. The problem has been that there has been a fixation error where the public health officials have concentrated on one thing and one thing only, to the detriment of every other medical condition. And that has been disastrous. What we are seeing is probably the worst public health disaster experienced in Australia, in Victoria, and across the world because of the reactions to this, because of the harsh lockdowns and the unnecessary and misguided advice given by the public health officials, including people like Neil Ferguson, people from the London School of Tropical Medicine and Hygiene and the Imperial College London. And it's been quite extraordinary. The PCR testing, which is extremely problematic in terms of the test that is not fit for purpose, that it's not designed to show infectivity. And yet in Australia, a population of 25 million, we've done 9.5 million tests on asymptomatic patient population screening. It is not what a PCR test was designed for. It is being used in order to produce the numbers of cases. The cases aren't related to symptomatology. And this is what's driven our country, our governments, based upon the advice, the science that they've been given by advisory committees, to doing lockdowns that are causing things like delayed cancer screening, delayed cancer treatments, delayed healthcare for every other medical condition, top 4 cancers, increasing deaths. All of these things have been predicted and we are seeing as a consequence of the lockdown. So David Nabarro, who's the delegate for the World Health Organization, Director General, he said that there's going to be a doubling of child poverty in the next 12 months as a consequence of the first world countries locking down and doing these things. There's going to be a doubling of child malnutrition. There's going to be probably an extra 6 million deaths, and the first time in a decade where child mortality around the world has gone backwards. So the impact of these decisions by these scientists who are advising about this viral outbreak and the public health recommendations have actually been quite devastating. And that reality needs to be taken into consideration. The fact that that's not been raised by people from the countries that you're talking about, it seems like a lot of United Nations recommendations are not understanding this, is quite concerning. The concern about the vaccine as well, the fact that there are treatments in many countries around the world that are using hydroxychloroquine, has been banned. This is the interference of political in the doctor-patient relationship. Hydroxychloroquine has been banned, as have other ionophores, for the treatment of early COVID management of this. And this is extraordinary because there is overwhelming evidence now that's available to any doctor who wants to have a look at it on various websites that are collating all the evidence. There's going to be a Senate inquiry in the US on November the 19th, where experts from around America and around the world will give testimony to the evidence that's available that's been ignored by public health officials in favor of things like remdesivir and the vaccine that's supposedly coming, right? That they have spent tens of billions of dollars trying to push forward. You have to follow the money on this. Look at the companies that are pushing this. Gilead, who own remdesivir, and their merger with AstraZeneca and Pfizer. Look at the money that is behind this and what is pushing this. Doctors should not be naive about the political background of what is pushing this agenda the world over. They should be looking at what's happening with the tests. Why are they doing this? Look at the definitions of the deaths. When Professor Dolores Cahill in Ireland looked at and followed down the death certificates through the coroners, they took the number of deaths from COVID, which was originally meant to be at 1,700 down to less than 100. So we talk about the transparency and the understanding of what's actually going on, and doctors being integrity and honesty and transparency. It is utterly failing. And we don't even know the public health officials that are making these decisions in our government, and I'm sure you don't around the world. This is hidden. The decision-making, the evidence, they will not present it to us. The evidence that we have says that all of the decision-making has been flawed and misguided and driven probably by economic and political interests. The fact that you guys are not aware of this is really quite surprising, and no one's raised these concerns. I think you should tune into on November the 19th to the Senate inquiry into the issue of treatment around the world and how it's been blocked by political operatives and political governments. I'll give you one example. In one of the states based on no evidence at all, very little evidence, in fact, based on flawed trials such as the Solidarity trial, the Recovery trial, which looked at hydroxychloroquine in the late stages. On the basis of that, a government has said that you can go to jail for 6 months if you prescribe hydroxychloroquine in this condition. It's just, that's political interference with medicine at an extraordinary level, and it's happened across the world, and there are people dying as a result. The hcqmeta.com website and also the C19study.com that collates all of the evidence that's around the world on this are saying that approximately 600,000 lives have been lost as a result of the banning of hydroxychloroquine. That is a massive public health issue, and if you guys are not aware of that, you should be. I'll stop now. Thanks.
Yeah. So, Eamon, I'm sure all of us are aware of it, and like Professor Vivian is talking about, that it's difficult to raise these issues. We are aware of it, but it has so much of political, what shall I say?
Can I say,
yeah.
maybe there are groups of doctors standing up for this against the coercion that has been put down through the medical establishment, such as the World Doctors Alliance, the Belgian doctors, the US doctors are coalescing. There's German doctors. Read what Rainer
That's a
Fulnick
small
is
voice.
writing
That's
about.
it's like, fighting giants. It's a small voice, isn't it?
No, but they've had significant inroads, both on a legal sort of level. In Ireland, doctors are now going to be accused of falsifying death certificates by putting COVID-19 down when it's completely misguided. They've been encouraged to do so. The financial incentives in nursing homes and to families to have COVID deaths is being exposed. A lot of doctors who have been colluding with this will be exposed and be open to legal sanction. We're actually doing legal proceedings on the advisors that have advised the governments to do these sort of reactions, policies and strategies, and we're going after them legally. There'll be accountability for the public health, often faceless public health officials that have made these disastrous decisions against the weight of evidence, particularly on treatment and lockdowns and various other things. This shouldn't happen again. The lack of information and the overreaction, the closing of schools, the impact that it's had on children is just absolutely devastating in terms of their education. It's been mentioned a couple of times about domestic violence and various implications of these decision-making things. The fact that children are just not affected by this, and the transmission between children and adults is not an issue. The average age of death in our country and across the world for COVID-19, apparently from or with, is 82 years old, which is above life expectancy. They all happened in nursing homes. 75% of them did in nursing homes.
But
neglect.
Elsewhere it is 65, Eamon. It's 65 to 80. It's not above 80. Maybe in Australia, but otherwise it's 65 to 80. That is the projection.
Yeah, the average age of death in Australia of the 800 deaths that we've had has been 82.
Yeah,
but as a consequence,
most of them in nursing homes. Yes,
and we've destroyed the economy as a result of this.
Dr. Matheson,
yes.
Dr. Matheson, let me ask you a question. Let me ask you a question here, because I think you've made a very impassioned, series of statements, which I think are all very important. How much of what the basis of what you're saying now did you know 8 months ago, 9 months ago? Did you know all of this 9 months ago? Because I think it's important. Again, let me I don't want to kind of respond to you once you answer, but the point is you did not know this 9 months ago. I did not know this 9 months ago. 9 months ago, we did not know SARS-CoV-2. All that we knew that China had instituted rigorous lockdown around Wuhan, and basically it was having some good effect, right? That's what we knew. We did not know how exactly it was coming across, from what parts of the world, that basically there was some suggestion that the really old people were more vulnerable, but we really knew much less about it than we know now. So I think it's really important, as you talk about your absolute conclusions about what we should and should not do, to keep that fact in mind, that people were reacting to a situation that they didn't fully understand. People were dying, they didn't know what to do, and they saw some examples of, and this actually in my mind highlights the importance of sharing information, and really all of us really being very active in promoting sharing information from across the world, and doing and really, let's be humble. I mean, that's all I'm suggesting.
I completely agree that it may be understandable that in the initial phases when this thing was coming out, there was a startle reflex across the world, but we're now 8 months, 9 months down the track, and the policies that are still being in place in my country and around the world, we have the evidence, right? We know what's happened now, but we're still acting as though what we didn't know and what was coming down the pipeline is still the case today. The infection fatality rate has come down to 0.13, 0.14, which is the equivalent of a severe seasonal flu. We know this, right? We know this. It was estimated due to a mistake with the CFR, which Neil Ferguson did, and all the computer modeling was completely wrong. They estimated 10 times this, or it was an order of magnitudes higher. We now know it's different from that. That's not well published. The people who are now making the decisions about this around the world have not taken into consideration the new evidence, the new understanding of this condition. This is the problem, and they're continuing to advocate for masks. I can tell you about masks if you want. I can tell you about lockdowns. The World Health Organization, in its publication last year in 2019, said that lockdowns should never be a part of a public health response to a respiratory-like illness in any situation. They turned that around, and the consequence has been devastating economically. And you guys should know that economics is health. They are not a false dichotomy. If you have poverty, you have problems with your healthcare outcomes. And the fact that this was a dichotomy, a thing that, oh, we can shut down an entire economy across a nation. The Africans are seeing it. He's one person that's acknowledged that this is a consequence. But if you devastate your economy, you devastate your healthcare. That's just a reality. Everyone knows this. Everyone should know that in public health. But everyone very readily shut down entire economies around the world. Why did they do this? This is the question you have got to ask. There's something far more behind this. This is not about healthcare. This is about economics. And that's where the politics is involved in this. And you guys should do a little bit of research and find out look at what the World Economic Forum is doing, what they want to come out of this, the Great Reset. If you don't know about this, you should. If you don't know that they've been colluding with Johns Hopkins, as well as the Gates Foundation, and if you don't know about, Event 201 and how this played out and how those bureaucrats have been running this around the world, you should know and you should look into it.
Okay.
I'm just going to make one last comment here.
I don't want to make this as a debate.
I like your impassioned play, but conspiracy theories from anywhere.
Not a conspiracy.
Hear me out now. We've heard your impassioned criticism of us all and of the world at large. Let me say something to you. Take a look at all available information, and you're absolutely right. Let's not be misguided, misled. Let's look at all available information, but also let's have some respect for each other and each other's integrity. Just like I respect your integrity, I also respect the integrity of my scientists, or I respect the integrity of Dr. Fauci. I know these. I know 2 of the 7 people on President Biden's COVID task force. I respect them. Not that I believe in everything that they say, just as I did not believe everything that you said. However, I respect what you're saying. I will look into what you said. But please, before spouting conspiracy theories about a health industrial pharmaceutical complex, I think it's important to back up and be careful in what one says, because it's not helpful.
Yeah, the thing is, all right, let's not, thank you, Emin, for giving your perspective. The thing is now what has happened is WHO, who is supposed to advise on matters such as this during the pandemic, people have also lost confidence in WHO.
Absolutely.
Something is not going right. We know there may be a lot of things involved. There may be pharmaceuticals. We don't know. We can only suppose. Time will tell. Only once we get through this pandemic, we will be able to find out, a lot of other things, what has happened behind the scenes. But as of now, as healthcare professionals, as doctors, as scientists, and we all have a role to play in this. But sometimes our voices cannot make a difference. And because the political power is so much that, Professor Rajiv, all of us don't have that much of, connection with the political spheres. But we do what we are told because we have no choice. But it is important for us to realize that we we should raise a voice when we feel that things are not correct. But sometimes we don't have. Countries like, I think Professor Ravi has already said what has happened to India. None of the advices from the healthcare side was taken by the politicians. So there are a lot of people who we can blame, but what we're trying to say in this whole webinar, or rather get the essence of it, is there should be some understanding. Some politicians should be able to take the advice of from the scientific world, provided the science or the advice is correct. Now that we will never know. Now, because after Emin has said, the advice is wrong, we don't know who actually advised the lockdown. Wuhan, it happened in Wuhan, China. They locked down, so the entire world locked down. Did anybody advise? It was a knee-jerk reactions because we didn't want the infections to come in. So we really don't know. I just want to let everyone know that, we all have a part to play. We can't, as much as we want to blame politicians, we also have the healthcare, scientists also are very, doctors or whatever we want to call ourselves. We are also responsible in many ways. Now, what is right, whether to wear a mask, not to wear a mask, we'll never know. But at the end of this pandemic, I hope each country can come with something constructive. That will be the best part of having these deliberations, that that we can improve our public health system. In India, the public health system is broken, and that is why the whole, we could not prevent what happened in India. The same probably for Africa. But there is a political influence in this. Now, I just want to know, why has WHO lost its, why have people or the scientific community lost faith in WHO? If you feel they have or not have. Professor, I didn't give a chance to,
Alvin.
are you there? Your screen is always rotating.
Alvin.
We are feeling dizzy looking at your screen. Professor Alvin. You're in the car, I think. Can you unmute yourself?
Well, I
Professor Alvin is from Hong Kong.
Can you hear me?
We can hear you. Yes, there we see you. Okay, go ahead.
Well, I think in China, the political system is such a way that we can make decisions swiftly. And it's not like the democratic countries where the ruling parties will always be pulled the legs by the opposition parties, So the efficiency would be less so. But again, I think the political manipulation is always there. So especially, I would think that in every country, just like our friends had mentioned before, we in fact are technocrats. I mean, health officials are only technical bureaucrats. These, politically speaking, are less powerful than the bureaucrats working in the finance and the economy. And those bureaucrats working in the finance and economy will be subordinate to the political bureaucrats who made the decisions finally. And they suppose have to take everybody with stakeholders, every stakeholder's concern. We are only one of the stakeholders. So I think we have to live with it. Even in America, we can say that Donald Trump perhaps is very disrespectful of the scientists or the health officials, but then he's in power. And so I think we have to understand this is reality. The fact is like that. So I think, on the other hand, I could see that, say, in the last issue of the New England Journal of Medicine, all the editors signed the petition, or they spoke out against the government or Donald Trump in the whole editorial. So I think that is something that the doctors could do with solidarity. But I totally agree with Iman and also Professor Ravi. Honesty, integrity, and our expertise. These are the something that we have to uphold. Even doctors and scientists could be, I'm so sorry to say, be influenced by the financial incentive for the funding. I mean, who fund the researchers, who fund the studies? So these are something that we have to doubt, just like what Iman had doubted. I, in fact, agreed with Iman. This is something that we need to always be brave and courageous to stand against such temptation and financial incentive. In Hong Kong, we are in a democratic system, but then still, politically, I could still say that health officials, we are only part of the picture. We can give our expert advice, but we are only one source of advice that the government would listen to. So then we have to be as convincing as possible. We have to be as persuasive as possible. So we need to study marketing techniques so that our voice could be effectively heard and heard by the people, so that the people's power would push it back to the government. I think that is necessary, but we doctors are very simple people, scientists, people serving the needy people. We won't think about those marketing or public speech, but those are the more effective way of pushing the government, I think.
Thank you, Professor Alvin. Deborah, can I come to you, Deborah? I'm sorry, we had to make you wait.
Don't. Congratulations, Professor Russell, Professor Mary, and Professor Derek. It's an honor for me to stay here discussing with a lot of authorities in COVID and bioethics. I'm not, I don't speak very well, I'm sorry, because when I get nervous,
Deborah, Professor Leon will, if you want to speak in Portuguese, Professor Leon will translate, and then Ariel will translate it back to English.
Okay, if you think it's better, I can do it.
No,
that's okay.
You can talk.
You can talk. Yeah.
You can talk English also.
Yeah,
that's not a problem.
Okay, it's good for learning for me
to learn.
Yes. In my country, COVID cases have grown again. The political campaign today, we have elections for the mayors of the cities here. We have about 5,000 cities in Brazil. So today we have elections, and people are at the streets to making campaign to their candidates. It's a preoccupation for us. As well, the politician in driving fence mission to be taken. At the beginning, it was a great movement to institute the hydroxychloroquine here to treat COVID. We had a big political problem. The country was divided in the doctors that believe in hydroxychloroquine and doctors that don't believe in hydroxychloroquine. We had a big problem, political problem here. But now it's pacificated. In spite of this, Despite the political situation, doctors have improved their knowledge of COVID and have been successful in reducing mortality. Here, especially in my city, the mortality is reduced in private hostels. In public hostels, it's not very good, but in private hostels, it's very good. We have the mortality is less than was in the beginning of the pandemic.
Okay.
And the Brazilian, sorry, only to say to the people, I'm the director, I'm one of the directors of Brazilian Medical Association. I'm director of parliamentary issues. And the Brazilian Medical Association promoves a lot of webinars with scientists to discuss the case of the COVID-19, the pandemic. And we have a pacific, now we are pacificated. The doctor may prescribe the treatment according to the patients. We have to explain the patients how will be the treatment, and the patient must accord with that treatment, and we are pacificated now.
Okay.
Can you understand me?
Yeah, thank you. Does anyone want any clarification?
Sorry?
Does anyone in the panel want any clarification from Deborah? No, okay. Now I just want to bring this issue of WHO back again. Thank you, Deborah. WHO it's the World Health Organization, and they are supposed to be giving scientific advice. Now on the panel, we are saying there are doctors, there are health professionals, there are epidemiologists. Now they are the voice. They are the ones who are, telling the whole world what to do. But then you see time and again, they say something and then withdraw. Say something, because there's a question by Professor Shashank Dalvi also. WHO advised about lockdown and then, a lot of things. Now, we are saying today that, we should have a good scientific community to advise the politicians. But when we have something like this, we advise the, WHO puts out something and then, takes it back. It gives very conflicting message to the public. So why should the public even trust WHO? Why should they trust us doctors? Why should they trust anybody? What is your view? Vivian, what's your view?
I agree, but I think people are understanding. The general population here in the UK does understand, I believe, that the science is progressing. More things are being discovered about how best to treat this disease. And, we do understand when the advice changes, when we hear that certain drugs are not beneficial and that others may be. And we're prepared to go along with that. We trust people who are working on the front line. I mean, it's a dreadfully difficult illness to treat. We know that, but more things are being discovered all the time. And we do accept that. It's still a learning curve for all of us.
Okay.
I don't think that's really a big issue. I don't hear people complaining about the medical advice changing.
Okay, the medical advice is okay, but what I'm talking about is WHO per se. There's a...
Oh, yes, I see. I understand.
Yeah, there's a loss in confidence in WHO.
Yeah.
Yeah.
I do agree. Yeah.
Yeah. What is your opinion, Vivian? Do you have anything to say on that?
Well, I think one of the things that I found particularly difficult was that.
Go ahead. I think it's Professor Alvin. Okay.
Yeah. Okay. Did you want me to finish quickly, or
yes, please? Yes, please. Go ahead.
One of the things that people found troubling in this country was the way that President Trump just dismissed the WHO out of hand. and that was very difficult for us to understand and grapple with, because we're all working towards the same end. We all want to deal with this pandemic, and we do appreciate that. Yes, there may be, again, come back to the same thing. WHO is a trusted international organization in the UK, generally.
Okay, all right. Professor Joe?
I'm trying to increase trust, we have to do better communications. Generally, when we've worked at other biomedical events, the public trusts their personal physician, and by extension, they would trust a physician who's a physician leader. And historically, the physician leaders have been on the same page as public health. That's all been fragmented, and we haven't pursued a means to pursue risk communication. We had plans in place, but they've all been just trashed in the past 5 years. That's why Fauci remains probably the most trusted person because he's an actual physician, but he's trying to speak for the public health leaders. Our Surgeon General used to be the voice for medical fields, but they've been compromised the past several years.
Yes, is America, did they take the advice of WHO?
No.
No,
let me back up.
I'll come to you, Professor Rajiv.
No, this WHO thing, I think, in USA, I think is an interesting thing. We expect
I defer to Rajiv.
to have some abilities that it doesn't have. The WHO is essentially an organization that all the countries are part of. It doesn't have any implementation authority. It
no,
just
that's true.
has
authority. Right.
So let's be mindful, and it has to function in each country with the permission of the government of that country. And so I think it's really important to keep these things in mind. When things don't go right, we point our fingers at each other. And I think it's important for us and hold people responsible who may not have the ability to have done things differently. So let's actually, in my mind, it's important to step back. I think what USA getting out of WHO was a terrible mistake, was wrong, was immoral. And I'm glad we're going to be getting back into it. But I think it's also important to recognize what the WHO can and cannot do.
Okay.
May I add something?
I'll come just one moment. Yeah, but that is an advisory body. It has no legal standing yet, a legal authority, but it is an advisory body. Professor Elvin?
Yes, thank you. Coming to WHO, I think there is an inherent difficulty in it because it has no legal power, first of all. Secondly, in the social medicine or involving with political decisions, then it comes to be a very complicated issue with cultural differences, with political systems differences. And I think I just get an example of the masking, efficiency of masking is positioned in the prevention of COVID-19. Say in Hong Kong or in the Far East, Southeast Asia, we are very accustomed to putting on a mask and also keeping a social distancing. So to us, this is not difficult at all. And so in fact, in Hong Kong, in China, we had really legalized the universal masking very early on, since February, But WHO still issued guidance against masking. I mean, not thinking that masking is useful at all, even perhaps until summer or autumn of this year. And in many countries, still the people do not believe in masking at all. So this is some cultural difference that affects the people's acceptance or guidance on masking. But say from Hong Kong or from China, we think that masking is, and even there are reports, scientific reports showing that countries with universal masking really seem to have better performance.
Outcomes.
Yeah, better outcomes. So, but then I still clearly remembered, in fact, in February, our government also issued their political statement that we don't need to put on masks at that time, against the advice of medical doctors. At that time, medical doctors advised that masking is necessary, should be universal, but the government followed the advice of WHO in February and followed the advice of UK at that time. So that creates some conflicts between doctors and the government. But then government, just within about 2 weeks, they have to succumb to the voice of the doctors in Hong Kong. And they switched to follow the advice of doctors instead of the advice of WHO. But then, of course, history told us that 2 or 3 months later, even WHO changed the mind. So that's what you said. WHO sometimes has to change the mind. But sometimes this, as Professor Vivian has said, medical science is progressing with change of evidence that show the contrary. Then we have to follow. Just like our advice on cholesterol and medicine on cholesterol.
It's changing. It's changing.
Yes. So in this case, we have to give the confidence to the people still to believe in science from the evidence. And on the other hand, we have to respect different cultures and different habits in different countries. And that's the difficulty WHO will face. It's an inherent difficulty. Then we have to be sympathetic and empathetic and don't act like Donald Trump. Don't just because you think that is too on the side, just on the side of China. So it's a different interpretation, you know?
Okay, I think we've done enough of Trump bashing here. Okay, Professor Ravi, how was India's stand on, was it taking advice, WHO advice? Because we have Soumya Swaminathan was there on the panel, right? From India.
Yeah, thank you, Professor Maury. We at World Medical Association in a public statement have requested the American counterparts to again rejoin. But at the same time, we have strongly advised that there are the limitations in the working of WHO.
Okay.
And it has to increase its credibility. And this pandemic has exposed those weaknesses. Having said this, we feel that WHO is still the best option available in the given circumstances for multilateral cooperation. And it is doing a fair enough job. And not only Professor Swaminathan is there, now our own health minister is the chairman of the executive committee of WHO.
Sure, yeah.
But WHO needs to improve upon its working, that is for sure.
Yeah, that's true. Thank you. Professor Leon?
Yes.
What about, did Argentina take any WHO advisory that was put out by them? WHO? Ariel?
Sorry, yeah.
Did Argentina listen to WHO advice that was given? World Health Organization, Ariel. WHO.
Yes. Pregunta si Argentina escuchó consejos de la OMS, Organización Mundial de la Salud.
Escuchar sí, poner en práctica no.
They listened, but they didn't put it in practice.
Okay. That's another one. Okay. They listened, but they didn't put it in practice.
Yeah.
Okay. And why? Why not?
¿Por qué no?
Los problemas políticos internos fueron mayores que los consejos recibidos.
The political issues were bigger than the advices that we received
from them. Okay. Right. Thank you. Thank you, Professor Leon. Professor Walter? You're muted.
Hi.
Yeah.
Yep.
What happened to Kenya? Are they following the WHO advisory or?
Yes, thank you. Kenya is actually following the WHO advice very closely. Yeah, so all the guidelines that we have in the country against and for prevention of COVID is in line with WHO guidelines.
WHO. Okay, right. So at least one country is, has faith in WHO. So this has been a very interesting discussion. If you have noticed, that's to all the panelists, there are a lot of questions running through the chat box. And if any of you would like to answer some of it, maybe I'll give it to Dr. Derek. Would you like to take some questions? Because, and I think it was, okay, there are way too many chats
No,
in the
I
box.
think most of the questions were answered probably on the spot.
Okay,
and I thank the
I just want,
panelists
I just want to tell Iman, I'm sorry, Iman, Dr. Joseph Philipraj had said that there is no, regarding hydroxychloroquine, what you mentioned, there are studies to show that it has not been effective. Whereas you are saying that it is effective. Can you put the reference in the chat box so that our participants will be able to, access it?
I sent the links to everyone. They can look at it. They can look up either c19study.com, which collates all of the evidence so that readily available.
Right.
Also on hcqmeta.com or metahcq.com. I've put all those in there. All the evidence is available. Covexit.com is a collection of, but I put it in the link, so you can look it up yourself. Look at the evidence. I'm also going to give you the evidence on masks. So I think it was Alvin Chan talking about masks.
Yeah.
We did independent study with QTech International, as well as the Center for Evidence-Based Medicine. They look at all the research that's been available for the last 20 years on masks, other than the meta-analysis that came out on Lancet, which was used to cause a mandatory compulsory use of masks around the world in many legislatures. Of the 50 countries that mandated compulsory masks, there was basically, the evidence is, studying the cases, there was no effect at all. So if you're looking at evidence, you've got to actually look at the evidence and what's available, the actual studies that have been done. Our Department of Health published there was a study with 1,600 Vietnamese health workers, who was a randomized controlled study with 1,600 of them. It was published in our own government's Department of Health document. It found that the patients, or the people, the health workers in Vietnam that wore cloth masks all the time compared to no wearing of masks, had a 13 times increase in respiratory illness over a 6-month period of time. So the harms, not only the usefulness, but the harms is well documented. You can look it up, it's available. These are references that are being used by governments and departments of health around the world. Look at Carl Hennigan and Tim Jefferson at the Center for Evidence-Based Medicine. They do the best studies of the research of what's available on masks, and not the impressions that doctors in Hong Kong might have about its usefulness. So I can put that in the thing as well.
Please put it put the link in the chat box. Thank you very much. It's really nice to hear another voice, a different voice, Iman. So
I probably won't be invited back, but that's okay.
Yeah. So I just want to,
that doesn't happen here.
Yeah, usually we don't get that. Yeah. I just want to, I think Professor Santanu took offense to what I said, and what I said, that the Indian health system is broken, and he said, no, it's not broken. I apologize. I didn't mean to say it was broken, but of course it can be, more effective. That is what I meant to say. So that is my apology from regarding that. Now, I just want to wind up just two sentences on how we can take, we started with politics and science, and how politics has an influence on science, or science influencing politics. Now, just two words where we can move forward on a positive note regarding this whole topic. Professor Rajiv Tandon, I'll give you the first, you're the opening batsman, but just 2 minutes, Professor.
I still don't
2 minutes,
understand.
two sentence.
What is the question you're asking me? I'll limit myself to one sentence.
Okay. The question is just, we're going to wind up. So we were talking about the influence of politics on public health science and the role of, how science can affect politics and politics affecting science. So what is your take on it? At the end,
What I would say is we have a very important place at the table, and we have a responsibility to our profession and to the people we serve, the people at large. And I think as we think about this relationship and our role, we should think about we have an important place at the table, and we must fight and make sure we have that place at the table. We must also think about, well, is ours the only one? Should we be the only people who have a place at the table? Or do others also belong there? If so, who should be at the table? What should our respective roles be? Can we respect each other's particular expertise? And then with that, how can we actually make decisions, and recognizing that I might have a very important voice as a healthcare professional, and a critical voice maybe, but not the decisive one. And it's okay if I'm not the decider.
Okay, thank you, Professor Rajiv. Professor Leon, Ariel?
Yes.
Yes.
Your
Yes.
final message for the role of politics and science, and how can we move forward?
Un último mensaje que quieras decir para el rol de la ética y la política antes de seguir adelante.
Ethics must always guide both science and politics.
Okay.
It is a permanent tension in which the best balance must always be sought. It is the task of those of us who dedicate ourselves to bioethics to find ways to incorporate this issue into scientists and politicians. Politics must always be at the service of the people. At least that is what we who want to continue living in democracy believe, which despite being a system with many defects, is the less bad of all government system. The father of modern sociology, Max Weber, spoke of the ethics of the conviction and the ethics of the responsibility. In this moment and uncertainty, we observe that politicians are not generally acting with the necessary ethic of responsibility. It is possible that in many cases they have altruistic convictions, but the results seem to show that the way is not found. In this situation, science cannot necessarily become the driver of political activity. It must be at the service of everyone's interests, and that is necessarily a political action. A few weeks ago, Yuval Noah Harari warned about the need for a global economic rescue plan. He said that over the past few years, xenophobic and isolationist politicians have deliberately undermined international cooperation and the very idea of global solidarity. Now we are paying the cost of that attitude. This pandemic cannot be stopped without close cooperation between countries around the world.
Yes.
If each country works to resolve its internal situation, the result will be a several global recession that will hit everyone. Rich countries like United States, Germany, or Japan, will find a way somehow. But poorer countries in Latin America, Asia, and Africa could completely collapse. The United States can afford $2 trillion package to rescue its economy, but Argentina, Egypt, and Bangladesh do not have similar resources. Unfortunately, up to now, there is no global leadership like the one that is needed. The Donald Trump administration made it clear that it is not willing to take on the role it did during the financial crisis of 2008, of the Ebola epidemic in 2014. It has made it clear that it will only worry about its own country. She abandoned her all Western European allies. But if the United States launched a global aid plan, who would believe it? Who would follow its leadership? Hopefully, the pandemic helps humanity realize the danger posed by global disunity. Instead, effective international cooperation were achieved, it would serve not only for the coronavirus.
Professor Leon, what is your final word for this? Your final word.
Dice unas últimas palabras sobre este tema.
No, it is all I need to speak for the distinguished colleagues.
Okay. All right.
Thank you.
Thank you, Professor Leon.
That's his final word.
That's the final words. Okay. Vivian, final words? I think a lot
I'll be as quick as I can. Thank you.
Please
Can
do.
you
And
hear
nothing,
me?
please, nothing about President Trump.
No. The strongest message from me is that in order for us to move forward ethically and collaboratively, we need clarity about the facts to enable us to balance the competing interests, economy, protection of health, and so on. It's a very, very testing time. And I think we need help from the publishers, from the world of publishing, medical and scientific publishing, good peer-reviewed articles so that we can make up our minds in a sensible way, published as soon as possible. So thank you. And thank you for your excellent sharing, and to colleagues for being so patient.
Thank you. Thank you, Vivian. Miriam? You can unmute yourself.
Thank you, Chair. It's been a very stimulating discussion. My last words, we must have responsible scientists that generate knowledge responsibly, and the politicians must also demonstrate responsible leadership, but the public should be educated so that they hold these two people accountable. In that way, yes, in that way, then they will be able to see where they are being cheated, and they can raise a voice that can help. Thank you.
Yeah, thank you. Thank you, Miriam. Professor Joe?
Thank you. I think my last word is that politicians will always have their own self-interest, but scientists need to be objective and to be in the forefront of producing the evidence that is required for us to move forward. Thank you.
Yes. Professor Joe?
I think about the phrase, think globally, act locally. So a more commitment to focus on the process, which is consistent and will be more consistent in the actions we take each day. So when I go in to see patients, or if I go shopping for groceries, how am I going to behave in each of those arenas? I'll focus on the process and not just take a stance of what's right and wrong based on content.
All right. Thank you, Professor. Iman, I want to give you also a chance. I'm not leaving you out. No?
I think I've said too much, haven't I? So
no, but I need to include you. What's your last
I would
voice?
just say that I think we need to, doctors should be perhaps a little more skeptical about the powers of politics and the economy, and particularly communications. Well, the ability for the control of communications and knowledge and information, and we need to be very questioning even of our own experts, and we shouldn't necessarily easily follow the dominant narrative that dominated the world this whole year and has done previously, and to question more. We're meant to question and be very concerned about the failure of education, even of the experts on a moral level and ethical level. I think a lot of the experts that are making these decisions have a very narrow view of reality, a very narrow view of history and philosophy. We live in an era of very narrow expertise and a lack of wisdom. And I think that we've witnessed that as a worldwide phenomenon this year.
All right, you're like our conscience.
Not for you guys, I'm just saying. You guys should be aware.
Okay, Professor Ravi.
Thank you, Chair, for an excellent session. Even though this COVID pandemic is mainly a medical crisis, but it is multidimensional. Hence, we need to take a holistic view. Politics in a democratic setup will always have an upper hand. We as a health professionals should be able to influence it. While stating this, we also need a lot of introspection within ourselves also. And if we are able to assert ourselves ethically and morally, if we have that right, I think we can influence the politicians to take better decisions based on scientific advice. Thank you.
Thank you. Deborah, would you like to say something? Deborah?
Yes. Yes, thank you. I think that's the way is to have good sense to wait the vaccine. We have to be moderated, to agree in the science, because without the science, we can't go anyway. And we have to educate the population. Not only use the mask, but use correctly the mask.
Yeah.
Most of the people don't use correctly. Thank you very much.
Thank you, Deborah. Professor Alvin, did I give you a chance for your final message?
Thank you. Yeah, I think doctors do differ in opinions very often. And there is no absolute right and wrong sometimes. Just now, just like the Great Barrington Declaration seems to differ in opinions in the mainstream of opinions in the medical world in preventing COVID-19. I mean, also the political decisions concerning prevention of COVID-19. But everyone has their own reasons, and we need to respect each other. And with evidence-based arguments, I think that's very important.
That's a nice word, evidence-based argument. I think that is very important. Thank you very much. Thank you to all our panelists. It's been wonderful discussing and talking, continually talking. We've been on this for quite some time since COVID-19 has started, and we are still connected. So I thank you for to all of you who have taken all the effort. Some of you are very early in the morning, and some very late night, like Professor Russell. But thank you. It's been a stimulating discussion, and I hope we can. I think Eamon and Professor Russell are going to sleep now. And
what about Des?
Des also. Des is okay. He went to the beach, so he's okay. He's fine today. So thank you very much, and I hope we can continue such discussions. And Professor Russell, would you like to conclude?
Yes, thank you, Mary. Thank you for the moderating. Of course, this is we know that this is an area that has differing views. And people are also we are reaching the end of our tether, as it so to say, dealing with this for the last, and we particularly in Australia with the lockdown and so forth, people are coming to the end of how much they can take, and I really think it was great. We in fact we have with is it Jesna? Is that right? From Jesna, are you there?
She's there.
She's going to run. She's from the what is it? Someone asked about what about the patients, and she's the patients ombudsman, or she represents the patients in the European Union, and she's going to have a webinar bringing a patient's perspective to all this. So anyhow, it's very interesting that we have taken all this, and I want to thank all of you for that important. One of the important things I think after all this is the solidarity. All of us, we've thought differently. We had different, what I like the word, as you said, evidence-based arguments and so forth. But all this still reflects one important, very important aspect, and that is solidarity and cooperation. Article 13 of the UNESCO's Universal Declaration on Bioethics and Human Rights specifies this, and I think we have demonstrated it here, that we are demonstrating solidarity in the different ways we think, in the different ways we want to bring. But ultimately, what is all this about? Successfully coming out of this pandemic with the least of, we accept that there's a lot of damage, but at the end of it, we want to come out at the best as we can and certainly build back from there and make sure this won't happen again. So to that extent, we continue to do this. As you know, this is the 29th, we'll be having 30th. There's going to be another very interesting one and this is Rajiv from Berkeley, from the professor of economics and politics, doing a study of the of disparity in the world, how doing a comparison and looking at its impact on COVID, which has been presenting. So we'll have another, not now it's beyond doctors, but this will be, I think, political scientists and economists coming from Berkeley talking about this. So it's a good way of understanding all what's happening. And I think what Emon said, the economists have got, they see health and both together, and I agree with that, because health and economy go together. Anyhow, thank you all very much, and so we finish now, and we will see you all again. I want to thank all the distinguished panelists, Des Kyle from RMIT, who does his, the professor writes his summary. We'll have all this up on the web, as we do have all recorded, and the executive summary will be there. So with that, thank you.
Please thank Ariel also. Ariel, thank you very much for your contribution. Thank you very much.
He's now become the interpreter from the Spanish.
The official interpreter.
World, or at least the Latin American world to the Spanish to English.
Thank you very much.
Yeah,
it's been a pleasure. Thank you.
And so, thank you to all our distinguished panelists. We appreciate the time. I know that Rajiv and Joe have got up early, and Emon and myself and Des, it's already come to Monday for us. We are now in Monday. So, and Deborah, thank you. So we'll leave you now. We love you. See and stay safe and stay well. Okay. Love you and leave you.
That's a new word.
Thank you. Thank you. Thank you.
Thank you. All right.
Okay. Thank you.
Okay. Bye.
Bye-bye.
Thank you.
Bye-bye.
Thank you. Bye-bye. That was very good. Congratulations, Dr. Mary. You are getting better and better every week. I think that you are going to work in BBC, maybe.
I'd love to.
You are getting better.
All right. Bye.
Bye-bye.
Bye-bye.
Bye, everyone. Thank you.
Bye-bye, Leon. Bye-bye.
Bye-bye.
Imon.
We are live in yet.